Hello, myself and my colleague are here today from the Leeds Public Health team, and we are doing this presentation. It's quite a short presentation as an introduction to public health and ageing well, and hopefully it will be of use. So this is a bite-sized session, so it's not a very long session, and the aim is to provide key messages around a range of public health topics, specifically around ageing well, to support you to adopt age-friendly principles in your work. So we will have a short session on each of these topics. So we've got mental health and well-being in later life, moving more and falls prevention, infection prevention, food and hydration, and adverse weather and the home environment. So we know that as people age, changes may happen faster. So it's important that we all know how to support people in later life. So the first topic that we have is around mental well-being, and a bit of information about what we know of mental well-being and later life. There are 1 in 3 people aged 50 plus in Leeds that are experiencing mental health difficulties, but often this age group can be overlooked. Mental health is quite broad. It includes our emotional, psychological, and social well-being. And we know that anyone, anywhere, can be lonely or socially isolated. And this can have serious impact on our physical and mental health. We also know that people in later life show the best outcomes from talking therapies, but often have the lowest referral rates to these options for support. And with the right access to support, people in later life can recover from poor mental health. In terms of kind of aging and mental health, we know that some changes in life, like retirement, bereavement, sometimes health issues, can affect our mental well-being. And although it's normal to have ups and downs, it's important to seek support if things feel too overwhelming. So when we're talking about mental health, it's not necessarily a diagnosis. There's kind of all sorts of things that people may be struggling with. How you can make a difference in your role. So if you are a professional, healthcare professional working with people, here are some of the things that we would suggest. So making every contact count, also known as MEC. You may have unique opportunities to identify people experiencing risk factors for poor mental health and well-being. We'll give a link to MEC training later. Also local communities, so supporting individuals to find out about their local groups, activities and clubs that may be of interest to them. So for example, neighbourhood networks, and then accessing support as well. So for you and your role, if you have a look at Mindwell and the range of support services available in Leeds to support you in having those conversations. Mindwell in particular has a range of support from low-level prevention through to crisis support. In addition to these, familiarising yourself with signs that people may need additional support. So if people are feeling worried or sad a lot of the time, struggling to cope with daily life, not wanting to get out of bed, or losing interest in things they used to enjoy. There's also kind of linked to this is an awareness of the early signs of dementia and how to support somebody living with dementia. So again, we'll kind of highlight the additional resources and training that you may be interested in. The other bit of this is supporting individuals as well. So some of the advice that you can give to people that you're working with that they can do themselves is to speak to their friends, family, or someone they trust about how they're feeling. For people to speak to a professional if how they're feeling is affecting their day-to-day life, and thinking about things that could already be within their control to help improve their well-being. So considering the 5 ways to well-being, these are learn, be active, connect, give, and take notice. And understanding the impact of kind of various life things on people. It's not all the same for all of us. So just supporting people to reach out and seek that support if they would like to. And then the last one here on mental health is the services and referrals to support both you and the people you work with. So Mindwell is the mental health website for adults in Leeds and brings together information from the NHS, Leeds City Council and the third sector into one go-to place. There's also training offered by Mindwell about how to use the website. Then the second one is the Leeds Mental Wellbeing Service, and that supports people to manage everyday problems such as feeling low, anxious or stressed, or struggling with sleep. We then also have Being You Leeds, which has a unique offer in Leeds and provides free groups and activities focused on wellbeing. And then we also have the Better Together service, which uses community approaches to build personal and community resilience and improve health and wellbeing. So those are the kind of different levels of support that we would encourage you to consider for mental health in later life. The next topic that we've got here is moving more and falls prevention. So what we know around this is that movement needs to be easy and enjoyable, and that's the most effective way of maintaining independence into later life. It can be helpful when talking about this to frame movement in terms of what people gain. So, for example, being able to walk to the shops, meeting friends for coffee, being able to dress yourself, or doing the gardening, kind of those positive things that you are able to do when you are moving more. We have heard from people that later life can be a great opportunity to get more physically active if you may have more time. And also in terms of falls prevention, we know that falls are not an inevitable result of aging, but the risk of falls does increase with age. So building strength can reduce the risk of falls and injuries. There's some nice images down there as well from a falls prevention campaign we did, just highlighting all the different ways that movement might fit into your day. Again, the things that you can do to make a difference in your role is understanding and identifying the risk factors for falls and having conversations about falls prevention. We've got the Making Every Contact Count there again, so attending that training and embedding that approach in your work, and then following the falls prevention pathway and referring or signposting people for relevant support. There's an element here as well that we would encourage you to consider your own bias around moving more and older adults, and what people may be interested in, and what options we refer people to for support. And then again, supporting individuals with this. So we would consider holistic approaches to moving more. We would like people to be aware of potential falls risks. It's not always easy to recognise the things that cause trips, slips and falls, but over 50% of falls happen at home. So this is definitely something that people may be able to do themselves, and kind of understanding and identifying those risks. Doing regular strength and balance exercises can improve strength and balance and reduce the risk of having a fall. And then supporting a healthy lifestyle, so including looking after our eyes, eating and drinking enough, and being aware of the effects of alcohol. So these are things that people can do for themselves that you might be able to promote and encourage people to do. The services and referrals related to this. So we do have a strength and balance programme, which is designed for people with low mobility, and it focuses on improving balance, confidence, and reducing fear of falling. It's delivered by qualified instructors in a range of leisure centres and community centres across Leeds. We also have the Leeds directory, and there's a falls prevention and management link that you can find on there. And then we also have the Home Plus service, which supports people to stay safe and independent within their homes. Home Plus can help with aids and adaptations to prevent falls, energy efficiency and affordability, damp fixes and home repairs.
So infection prevention and control is a really important and year-round priority that should be embedded into your practice to ensure you deliver safe and high-quality care. It's really important to be aware of infections and effective infection prevention practices all year round, but we know that during the winter period it is particularly important as we see that higher circulation of infections. We see increased vulnerability with older adults and people with long-term conditions being more susceptible to severe illness during winter. People often spend more time inside as well with reduced ventilation, and there's often pressures on health and care services as well that we see. So preventing infections help reduce hospital admissions, staff sickness and service disruption. So everyone has a role to play in infection prevention and control. It's really important that it's embedded into your everyday practice and applied consistently in order to offer safe and effective care. So following infection prevention and control guidance protects people from being harmed by avoidable infectious diseases. Infectious diseases cause significant costs for the NHS and can cause serious illness and death to those infected. Preventing infections is also a really important thing that you can do around preventing antimicrobial resistance. So infections are a really common reason for A&E attendance, and around 1/3 of emergency admissions to hospital receive antimicrobial therapy, so such as antibiotics to treat an infection. Reducing infections lessens the opportunities for infections to spread and for resistance to develop. So antimicrobial resistance is a significant threat to antibiotic use, and that's when microbes evolve to resist the medicines that are designed to kill them. So resistant infections are harder to treat and illnesses may become more severe and last longer. So effective infection prevention and control is one of the most cost-effective interventions that you can do against this happening. Another key prevention of infections is vaccinations. So that's things including maternal, childhood, adolescent, adult and seasonal vaccination. It's one of the most effective methods to preventing infections. However, uptake across Leeds, if you're looking at childhood and seasonal vaccination, remain lower than the recommended kind of coverage rates by the World Health Organization. So it's a really key part of infection prevention is vaccinations. So there's lots of different things you can do around infection prevention that make a difference. We're just going to spotlight on 3 of the ways in which you can do this. There are lots more. So making sure you're applying high standards of infection prevention and cleanliness in everyday practice, and making sure you're up to date with your training and have regular reminders and updates to staff to ensure that there is that consistency across how care is delivered. So those key messages around good hand and cough hygiene, processes around donning and doffing personal protective equipment or PPE, and effective cleaning and ensuring proper waste disposal. Another intervention is keeping up to date with your vaccinations and making sure your required and recommended vaccinations are up to date. As we've said, vaccinations help protect you, but also protect other people from serious illness and really reduce that risk of spread from infection. And finally, the adherence to the guidance with the Gloves Off campaign. So this campaign is a healthcare initiative that's aimed at reducing the unnecessary use of non-sterile disposable gloves in both clinical and care settings. So rather than using gloves by default, staff are encouraged to assess the actual need for gloves and prioritise good hand hygiene unless there is a clear risk. So again, just promoting the importance and reducing the inappropriate glove usage that is linked to poor hand hygiene and increased risk of infections. So some of the messages you can promote to the people that you work with, which really support service users, are very similar. So again, ensuring good hand hygiene is in place, effective hand washing to prevent the risk of spreading infections. And if an individual is experiencing diarrhea and vomiting or have a cough or cold or flu, that they stay at home and get plenty of rest. Similarly, you're supporting individuals to make sure they're up to date with their vaccinations, particularly with this age group, with older adults or people with long-term conditions. They may be eligible for the seasonal vaccinations such as influenza, COVID and RSV. So again, it's about making sure people are informed and aware of eligibility, but also supporting them to be able to access this, whether that's through their GP or at a pharmacy. And finally, ensuring antibiotics are used correctly. So those key messages around only using antibiotics when they're prescribed by a health professional, always taking the full prescription even if you feel better, never using leftover antibiotics, and never sharing antibiotics with others as well. So there's lots of guidance available through the Department of Health and Social Care on particular IPC advice on different settings, whether you're a domiciliary care worker or working in a care home. And there are lots of resources as well that you can put up for staff to reiterate these key messages. Again, signposting to the Gloves Off campaign and the resources available there. And if you work in a care setting or a home care provider, accessing support for infection prevention control practices via the Leeds Community Healthcare Infection Prevention Control Team, who offer community support on safe management of patients with active infections, outbreak management and training as well. So there's a really comprehensive offer there. So making sure you access that if that is relevant to your work. So we're now going to look at nutrition and hydration. Good nutrition and hydration is vital for older people because they directly affect health and independence and quality of life. As people age, the risk associated with poor intake of food increases, particularly during illness and in winter months. So it's really important that these messages, even though a lot of us are aware of these key messages, it's making sure that we're looking at it from an age-friendly perspective and encouraging people in those opportunities that we have in our work to do so. So what do we know? So we know that what we eat can have a big impact on how we live, and our overall health plays a crucial role in determining our weight and can influence our risk of conditions such as heart disease and high blood pressure. Good hydration and nutrition is important for overall good health. Our bodies need water and nutrition for a wide variety of functions, so it's really important to ensure that everyone is eating and drinking the right amount to stay healthy. We know that being dehydrated can have serious health implications, such as increasing the likelihoods of UTIs, impairing our thinking, changing our mood, which can all increase the instances of falls as well. Sometimes dehydration can lead to hospitalisation and decrease the effective function of organs in the body as well, such as kidneys. As part of healthy aging, it's really important to focus on healthy weight, which can include identifying and supporting people at risk of managing malnutrition, as well as people living with being overweight or living with obesity. Ensuring good nutrition can help tackle malnutrition, which can be prevalent in older people, and help to strengthen immunity to reduce the risk of infection. It can also prevent diet-related diseases, support recovery from illnesses, injuries and surgeries, and enhance cognitive function and prevent decline. So what can you do in your role? One of the key recommendations is promoting the Leeds Food Consensus priorities. So those are the healthy eating messages for older people, and they cover a lot of what we've spoken about. So keeping people properly hydrated, making sure eating for health, really varied diet consisting of starch and fibre and protein, as well as fruit and vegetables, and ensuring sufficient calcium and vitamin D intake to support bone health, being a healthy weight and understanding what that is for the individual, and supporting and enabling individuals to have meal times which are positive experiences, and acknowledging the health benefits and pleasure of food as well. Secondly, finding out how and what and when an individual likes to eat and drink, and try to support implementing this as much as possible, and also monitoring those signs of weight loss as well. So really individualising care and looking at what the service user needs to ensure that they do maintain that healthy weight and are accessing regular drinks as well. And that's what the third point is around, which is around promoting hydration, reminding individuals that fluid doesn't have to be solely water if they don't necessarily enjoy that, and can include other drinks such as milk and fruit juices, as well as tea. If possible, that's recommended to be decaffeinated, as this helps to reduce the risk of fall, but also food that is high in fluid as well, such as ice lollies, jelly and soup. So our top tips for individuals really follows on from the actions that you can do in your own role. Again, it's encouraging individuals to communicate their food and fluid needs to ensure that they feel supported and catered for, making sure that they drink 6 to 8 cups of fluid every day and that they have fluids available that they enjoy. And if they have a small appetite or difficulty chewing or swallowing, trying to eat smaller meals and snacks 6 times a day, rather than perhaps feeling a bit intimidated by 3 bigger meals as well. So again, we've got lots of great services available in the city, one of them being the neighbourhood networks who have lunch clubs across the city, and you can find local ones depending on where individuals live. If you're supporting someone who is experiencing food insecurity, the Leeds Food Aid Network offers a range of information on local food providers across the city. And finally, there's guidance available on how to support someone you care with eating, and that's through the NHS website as well. So now going to be looking at adverse weather and the home environment. So depending on the setting that you work in, the home environment and weather can play a significant impact on how you work and how you need to consider the needs of the individuals that you work with. Professionals working in people's homes or in care settings play a vital role in recognising and responding to risk linked to adverse weather and the home environment, which are really important to be aware of as they help to keep people safe and healthy and supported all year round. Your role can help to mitigate and reduce health risks, prevent accidents and falls, and support safe living conditions. So there's lots of factors that can affect individuals' health relating to different weather events in the home environment. We know adverse weather, so that can be extreme heat or extreme cold, can cause injury and illness, cause increased demand on health and social care services, and affect mortality rates as well. This is often extreme heat and cold, but also can be weather events such as flooding. We know that living in a cold home can worsen asthma and other respiratory illnesses and increase the risk of heart disease and cardiac events. It also can worsen musculoskeletal conditions such as arthritis. Conversely, certain health conditions and medications can make people more prone to heat-related illnesses during heat waves or hot weather events due to the body's thermal regulation and fluid balance. Additionally, housing quality has a significant impact on health and well-being. We know that condensation and damp in homes can lead to mold growth, and inhaling mold spores can cause allergic reactions or the development or worsening of asthma and respiratory infections, and cause shortness of breath as well. So what you can do in your role, so you can sign up to the weather health alert. So these are an early warning system. So when adverse weather temperatures, so both hot and cold, are likely to impact on the health and well-being of the local population, these alerts are sent out, and they can be really helpful in having that early warning, and you can implement necessary actions depending on the scale of the alert. They have a red, amber and green scale, and they have complementary relevant action cards as well. So depending on the setting and where you work, they have the recommended actions that you can put in place in advance and during these adverse weather events. Secondly, you can check if an individual is eligible to the Home Plus Leeds service that we've mentioned earlier. They provide free support to vulnerable Leeds residents, and whilst they do a lot of work around falls prevention, they can also look at home hazard repairs, heating improvements, advice on energy costs and benefits, and can offer a really wide range of support. So it's a really important key partner to be aware of when thinking about the impacts of adverse weather and the home. And finally, there's lots of training available that's delivered by lots of partners across the city, including the Leeds City Council adverse weather training, and using the winter and summer checklists that are available. How to access those is available on the slides. For service users, you can support them to follow ventilation and air quality advice to minimise damp and mould in their home, using a room thermometer, which are available from the Public Health Resource Centre. That is a really useful tool to help start conversations with individuals if you're entering into their home and notice that the temperature is either hot or too cold for the current weather event, and that you can use it to make sure that the home temperature is in a safe range, and have that conversation around what they can do to either keep themselves cool or keep themselves warm. You can also signpost to the Home Plus Lead service that we've just referred to if an individual is struggling to pay for heating their home, for example, during cold weather. Or you can also visit and signpost an individual to visiting the Money Information Centre if they require advice and support around debt or housing or energy and fuel and food advice as well as kind of guidance on pension credit as well. Services and referrals you can use and refer into. So signing up to those weather health alerts and being aware of the relevant action cards, visiting the Money Information Centre, accessing information on indoor air quality via the Leeds City Council website, and additionally those accessing damp and mould information on the Leeds City Council website.
Thank you. So we've come to the end of our BiteSize training. So we just wanted to flag the Public Health Resource Centre that we have in Leeds. So this is available for anyone in Leeds with a responsibility or professional interest in public health or promoting health and wellbeing in Leeds. And this includes students and volunteers. We would encourage you all to find out more, including other training and resources, to sign up to the newsletter, which you can find on the Public Health Resource Centre website. There's also a short film, and as we said, all the links that we've discussed in this presentation should be able to be found in the description. So don't worry about copying the HTTPS over. So we've got the Public Health Resource Centre, and then we also wanted to highlight some other training opportunities. So keep an eye out on the Adult Social Care Provider Bulletin for training opportunities that may be coming out. We have a link there to the Adult Social Care website for recruitment, training and development. There's also, as I just mentioned, the Leeds Public Health training opportunities. There is also the PALS system for specific training. For example, there is food safety, nutrition and hydration on there. There's infection prevention and control, and other things may be added to that website that may be of interest to you. And then for care services as well, the Care Quality Team website has guidance and resources. So please do visit these various websites for additional training opportunities. And hopefully this was a helpful introduction and bite-sized session into some of the things that we would like to highlight around aging well and public health. Thank you very much.